Hi, this is Steve from Supply Physical Therapy, and today we're excited to announce our new partnership with SMI Cold Therapy, and we have Dave Hambro here to explain all the products that they offer. So Dave, tell me a little bit about what you do for SMI, and tell me a little bit about your company, if you don't mind.
Thank you, Steve. I am the Vice President and National Sales Manager of SMI Cold Therapy. I've been with the company since 2009. In 2004, we were founded by two great individuals, one who had sold all types of cold therapy into hospitals for many years. And our wraps are the product of all the objections that he would receive from nurses, physicians post-operatively in terms of why can't cold therapy be simple. We wanted to make a wrap and gel product that is effective, but also simple for post-operative use, but also can be effective for everyday bumps, bruises, headaches as well. In 2011, we built a brand new facility in Southwest Virginia, Rocky Mount, where we're based out of today.
Traditionally, SMI has been a hospital-based company selling wraps into the hospital setting for post-surgical. So now coming on with our three websites, just kind of give us a little insight on why you kind of switched it up or why SMI wants to get involved with this now.
Sure, we are very excited. This is the first time ever that we're partnering with companies like yours to offer these to basically anyone that wants them. These are the same products that we sell directly to over 500 hospitals, ambulatory surgery centers, and physicians' offices across the nation. So aside from any health system-owned pharmacies, this is really the only way that you can get our products coming through Steve without coming, to a manufacturer.
And I think the public, especially the surgery patients, are going to be surprised at the quality of these products. They are above and beyond what we're selling for other cold wraps. So we're excited.
Thank you very much.
So Dave, tell us what sets SMI apart from the competition. Say like the Donjoy Bregs or just the generic stuff you can get on Amazon.
Well, first and foremost, the performance and its ability to relieve pain, swelling, and restore range of motion. It's really amazing. We have so many letters from patients that have used this product after surgery and have not had to take any pain medication at all through their recovery. They say that this has been the answer to their pain, and it doesn't restrict their mobility either. So it can work just as well as a motorized cooler, but it's not going to impede their ability to function in everyday life.
So Dave, now I want to ask you some specific questions about the SMI cold therapy.
Sure.
Tell us a little bit about the compression straps, because I've noticed selling a lot of cold therapy, they are the nicest straps on the market. So tell us a little bit about them.
That's what we aim for, to be the nicest strap in the market that is nice and durable, comfortable, but also effective. The compression strap is going to cover the entire surface of the pouch that holds the gel packs in, so it can effectively drive the cold through whatever area you're applying this to. So if I were to just drape this on your knee, and how's it feel? Kind of cool.
It's a little cool. It's not cold. Yeah.
And those gel packs are fresh out of the freezer. They're actually frozen. Well, to get the full effect and to understand how powerful this is, wrap the straps on for a nice, snug, comfortable fit. And you notice the difference?
Oh yeah,
in the cold?
That gets cold so much faster now.
The area needs to get to a certain temperature to be therapeutic and start to relieve pain and reduce edema. And those compression straps allow that to happen instead of the cold just kind of laying on top of the surface of the skin. Now, the best part, stand up. It's not going to fall off or move while you're mobile.
It's not migrating at all, down.
So you can go about your daily business and it's not going to impede you. And it's not just the knee wrap. This is all the wraps that we offer. We want to make sure that the compression straps are going to be effective and won't impede movement, but actually help you to get up.
So I have a question. So being in the cold therapy business forever, like yourself, it has been trained or just driven into our heads. You never put this directly on your skin, but you put it right on my knee.
Yes,
Tell me a little bit about that.
The liner that we'll talk about soon, that is against the surface of your skin, is a protective barrier.
Oh, nice.
You never want to place the gel bag directly against
Right.
your skin. It's too cold anyway. But that allows you to put it directly against the area without any worry of skin damage or frostbite.
That's perfect. So much easier to use.
So exactly. And if it does feel a little cold for you, you can simply loosen up the straps a bit.
Okay.
So it acts as a bit of a thermostat.
Oh, nice. Yeah, I never would have thought of it.
Yep.
Dave, tell us a little bit about your innovative gel packs. What makes SMI different than the other companies?
Yep. So this is long-lasting but safe and effective cold therapy. So talking about the gel pack, when this is fully frozen, it's going to provide 3+ hours of cold. And the longevity is going to vary based on what you're doing and the environmental conditions, but anywhere from 3 to 3.5 hours when it's worn continuously on the affected area. I brought this thawed gel bag out to illustrate. There's two components. You have little mini gel packs on the inside with the liquid flowing around inside the gel. It's very important that these little squares are frozen solid before using them. You want to keep them in a freezer flat and ideally side by side. I know some people don't have space, so you can stack them, but make sure it's at least 4 hours. And when you take them out, make sure that the squares are frozen solid like that in there. And what you get is, after this has been resting out for a bit, the gel conforms to the area perfectly. The squares remain frozen solid. So when this is fully frozen, it's going to push a blast of cold into the joint and rapidly lower the temperature. And then the squares maintain that temperature for a long period of time. So it's a gradual warm-up period over the entire cycle.
All right, so Dave, we sell two different kinds of cold therapy. We sell the motorized version and we sell gel packs. Tell us why maybe you would use one or the other.
Yeah, absolutely. Motorized cooling machines are fantastic. They do a great job, and they are effective at relieving the pain and swelling. First and foremost, directly out of surgery, when you're not moving. You're sent home, then what? It's important to have a product that's going to deliver the cold but doesn't restrict movement. And that's what I would say is our biggest difference between the cooling machines, because clinically we provide an equal benefit, but we also allow movement. Yep. Whereas, and even if you just want to drive down the road, you're sitting, but it's portable.
So right after you have surgery, you're driving to PT or surgery, and you can't haul your machine with you in most cases. So
exactly.
So your product is very beneficial to those patients.
Yep. How about the times if you play sports or work out and you get a little muscle cramp and you wish you had that cooling machine right there. You throw the gel packs frozen in a little lunch bag or a little insulated cooler and just have them with you in your car or in your locker. That way, if you get that injury, boom, put it on, and you can even continue working out depending on what you're doing.
Yeah, it's a great benefit.
Oh yeah, we filmed I was just gonna say, we filmed a commercial where we had people golfing, throwing a football, hiking, doing all types of
what about walking
activities.
The dog? Can I walk my dog?
Absolutely, absolutely.
So hey, tell us a little bit about the white part of this wrap, which kind of makes it a little unique.
Oh yeah, yep, we call this our antimicrobial bandage liner. No one likes it when you're wearing an ice wrap, a bag of ice, cooling machine, and the area gets wet, clothing gets wet, whatever. This is moisture wicking. It's going to keep the area nice and dry throughout the duration of using it, so you don't have to worry.
When you have surgery.
Oh, absolutely, absolutely. And on top of that, woven into this liner from the very beginning of the manufacturing process are 3 different types of bactericides that when together act as a antimicrobial barrier. That's obviously important in the hospital setting so that the wrap stays nice and clean for the duration. But when a patient is at home, or when anyone's at home, this can be washed or wiped with any type of disinfectant, and that those antimicrobial properties are still going to be effective.
It doesn't go away. Oh, that's fantastic.
They actually call it bacteriostatic, meaning it's not going to wash out. Now, it doesn't last forever, but it's going to last for a duration of several months.
So Dave, can you tell us a little bit about the orthopedic indications of this product? What are most of the patients using this for?
Yeah, so they're using it to recover after total joint replacement surgeries, after trauma-related surgeries. It's given to patients pre-op to help deal with pain. Maybe if they're even not ready for surgery yet, it could be something that's recommended for them to use to help control their pain until, they and their physician believe that it's time to actually have the surgery.
Interesting. Yeah. Let me take this in a different route. Since we sell to the retail customer, can I use this for baseball or football or basketball or any sport? Or just the weekend warrior weightlifting?
Absolutely. You would think we built this for sports, even though we sell to post-op.
Right.
But it was made to be used, for my son is 10 years old and he plays on the 10U tackle football team. Okay. And I always have my gel packs in the trunk. If anyone gets a bump or bruise on his baseball team, the pitcher would even, you can cut this out, but they would hold the gel bags like this. Okay. Because their hands would get hot. The catcher as well. So they'd come and grab them after and just kind of go like that.
Oh, wow.
Give me that,
So there's a lot of applications away from the orthopedic side. That's interesting.
Yeah, absolutely. And it's great for post-spine use. We're getting into some general surgery with our ab binder.
What about plastic surgery, cancer, or any of these other indications that are out there?
Absolutely, absolutely. It can be used to recover after breast surgery. Any maxillofacial surgery. Okay. It's great for relieving jaw pain. We actually have a jaw wrap that we're going to be releasing soon. Exactly. And of course, the theme is, as long as it allows the patient to be mobile, we're going to do it.
Thank you for your time. This was very informative. Steve. We're looking forward to this at Supply Physical Therapy, and we can't wait to get this out to the general public. We're based in North Carolina. If you order before 2 o'clock, it'll go out that day. So give us a call at 844-505-8144 for all your cold therapy needs.